Yesterday we did a case together about an NRP type scenario where we are at a resuscitation for a baby born after a placental abruption. If you didn't see it after this video, go watch it so that we can talk through it together. Let's quickly talk about what is a placental abruption and what do we need to think about as the NICU nurse. So a placental abruption occurs when the placenta separates prematurely from the uterine wall, and it can be either partial or completely. It compromises maternal blood flow and oxygen delivery to the fetus, making it a leading cause of perinatal morbidity and mortality. It can cause prematurity, growth restriction, or acute fetal distress requiring an urgent or emergent delivery. So what do we need to think about with these babies when we are preparing to resuscitate them? Well, they're at risk for hypoxia and asphyxia due to that impaired oxygen exchange. As I mentioned, these emergent births, they can result in preterm birth, which can have its own set of complications. We need to think about the risk of anemia and shock from that blood loss, from that hypovolemia. These babies can have lower APGAR scores and need resuscitation at birth. Long term, they can have neurodevelopmental complications, especially if there was severe hypoxia. So what do we need to do when we're admitting these babies, and what do we need to think about? These often have respiratory distress, so we need to support their ventilation and their oxygenation. I feel like a broken record, but hypovolemia, there was acute blood loss, so this baby's circulating blood volume can be low. So we need to be able to support their volume. So giving normal saline in the delivery room, knowing your process for accessing emergent blood. These are essential. Also, these babies, like I said, they can have neurologic concerns due to asphyxia. So signs like lethargy, abnormal tone, understanding that they're at risk for hypoxic ischemic encephalopathy. And then if they're born preterm, the prematurity related complications like respiratory distress syndrome, intraventricular hemorrhage, glucose instability, and always thermoregulation for every single baby, making sure we're supporting their temperature management. So when you get called to these types of deliveries, make sure that you're able to anticipate their needs, establish vascular access early so that we can reperfuse and restore that circulating blood volume, closely monitor hemodynamics and neurologic status, and of course support the family in this scary and traumatic time in their lives. I hope that you found this interesting. Like I said, if you didn't see the case study, go watch it now and follow me for more NICU education.